Hello, this is Debu Tripathy from Cure Magazine, bringing you another update from ASCO. One of the trials that was presented today is a trial called the Bolero-3 Trial. That is a trial that combined Herceptin, which is an approved therapy against the HER2 oncogene, so about 20% of breast cancers that make the HER2 oncogene are best treated with the addition of Herceptin to chemotherapy. For patients with metastatic breast cancer, this combination we have now known for years improves survival, and it's become the standard of care. However, most patients at some point will progress and become resistant to these therapies. So we are looking for ways to combine additional treatments with Herceptin to maybe avert resistance or at least have patients enjoy a longer period of time without their cancer progressing. We've learned a lot about the biology of HER2 cancers and how they signal. One of the proteins that seems to mediate resistance is a protein called mTOR, and it can now be blocked by several different drugs, some of which are approved for other cancers, such as kidney cancer. So this trial compared standard Herceptin and chemotherapy. In this case, they used a drug called navalbine, also known as vinorelbine, and this was in the second line. This is for patients who had already progressed on a Herceptin-containing regimen in the past. And they compared that combination of Herceptin and navalbine to the same plus the addition of an mTOR inhibitor called everolimus, also known as Afinitor. The first results of this trial were presented today and show that in fact the addition of Afinitor does improve progression-free survival. It was statistically significant, but the duration wasn't that large. It was about a little over a month longer of disease progression. So not the substantive advances we would like to see, but at least we're moving in the right direction, and we know that conceptually that mTOR inhibitors can improve outcome. What we need to learn more now is what is the best time to use it. There's another study that is looking at it in the frontline therapy called Bolero-1, and the results of that we expect will be out by the end of the year. And what to do about the side effects. It turns out that this drug Afinitor can cause fatigue, it can cause mouth sores, and it can cause high blood sugars, and rarely it can cause inflammation in the lung. So we still have to learn a little bit more about whether the benefits, which are rather small at this point, are going to be outweighed by the side effects, and it's a little too early to know if people actually live longer with the addition of Afinitor. We expect that data will come later.